Hi guys, happy Pride Month. I'm really excited to talk to y'all today. I hope y'all have had a great month of June, and I hope y'all have been prideful and have been celebrating. I certainly have. I went to a Boy Genius concert really recently. I think it was like 3ish nights ago, but I had so much fun. I drew a little Boy Genius tribute tat on me just for funsies. And yeah, I also have some festive nails. My camera doesn't want to focus today, but you're gonna have to trust that they're really cute and I love them so much. But this is not the topic of the podcast episode I have planned today. So today we're going to be talking about mental health in LGBTQ youth. So the reason that I chose this particular age group was because clearly I'm in it, so I relate to what I'm saying a lot more, and I'm able to talk about it better and kind of from my own experience. But I also think that minors have a lot less access to healthcare compared to adults because of our age. And this is a concept that I've been super interested about, so I'm excited to share my thoughts with y'all. So obviously this is a conversation about mental health, so I am going to start with a huge important content warning, so please stop listening or skip to a different timestamp if you feel the need to. According to a 2023 survey by the Trevor Project, 67% of LGBTQ youth experience symptoms of anxiety. According to that same survey, 54% of LGBTQ youth experience symptoms of depression. 24% of LGBTQ youth received physical threats or harm due to their sexual orientation or gender identity. 53% of LGBTQ youth experience verbal harassment. 20% of LGBTQ youth experience sexual assault. According to a 2023 article from the Journal of Public Health, 65% of LGBT youth have experienced self-harm. According to that same 2023 survey from the Trevor Project, 41% of LGBTQ youth seriously considered attempting suicide this past year. 14% of LGBTQ youth attempted suicide this past year. I knew I just threw a lot of depressing numbers at you, and I don't say these things to make y'all sad. My motive here by saying these things is to help understand and talk about the importance of improving the mental health care system and society overall. Coming back to the Trevor Project's survey, 81% of LGBTQ youth reported that they wanted mental health care. 56% of these people were not able to get it. LGBTQ youth that included themselves in this percentage cited reasons such as being afraid to talk to someone else, not wanting to get permission from a parent or caregiver, not being able to afford it, or not being out or scared of being outed. I believe that not having access to healthcare is one of the most frustrating situations that you could ever be in. Minors have very limited access to mental health treatment, especially in the US, because here we have to get a parental or guardian permission, and we have to pay for it, and if one of those two things aren't able to happen, then we don't have access to that professional treatment that we're looking for. I made a Catalyst project about almost a year ago, maybe like 8ish months ago. Um, but it was about mental health treatment accessibility for youth, and I made this my project because me and so many other people I knew had this exact same problem, and you you see this problem more in kids who identify as LGBTQ, because what if they want a therapist to talk about their identity to, but they're scared to be outed and scared to talk to people and scared to ask their parents for help, because what if they aren't supportive of their child? In the Catalyst project I made, I've learned that 16.4% of children in the US has at least one or more mental health disorder, and of this percentage, 49.4% of these children do not receive mental health treatment. So, how do we move forward knowing what we know now? LGBTQ youth feel more welcome and more supported in the presence of affirming spaces. These spaces can be in their home, in their school, in their community, or even online. Doing your part means educating yourself on LGBTQ topics and experiences and stories. So some of these topics might include gender identity, sexual orientation, how to be a good ally, pronouns, the gender binary, microaggressions, and racism. By the way, racism is something that I haven't talked about in this episode, but I have so many things to say in future episodes about intersectionality. So, on to more lighthearted ideas. Here are some of my favorite LGBTQ creators. Go check them out if you want to. If you don't, that's fine too, but I wanted to share. Please, please, please remember that pride is still a real thing even outside the month of June. Pride should be celebrated year round, and I love you all so much. Bye, guys.